Webinar title, CCWIS Biennial Data Quality Reviews. May 29, 2024. Children's Bureau Division of State Systems logo.
Hello and welcome to today's webinar. We will begin in just a few moments. Thank you for joining us. Once again, just want to say thank you for being here, and we will begin in just a few moments. Welcome to the Child Welfare Information Technology Systems Managers and Staff webinar series, brought to you on behalf of the Health and Human Services Administration for Children and Families, Children's Bureau. My name is Philip Breitenbuscher, and I am your host for today's webinar. Today's discussion is entitled CCWIS, Biennial Data Quality Reviews.
Slide title, Participating in today's webinar. Text demonstrating how to participate is explained by the moderator. Questions after the webinar can be emailed to cwis.questions@acf.hhs.gov.
We would like to encourage your active participation in today's webinar, and there are a couple ways for you to participate. First, you can ask questions throughout the presentation using the Q&A feature at the bottom or top of your screen by clicking on the icon that looks similar to the one on the right of my screen here, the Q&A icon. We do ask that you submit all questions using the Q&A features rather than the chat feature. That way we can archive your questions and be sure to respond to each of them. You can also ask a question over the phone using the raise hand feature, and then we will private chat with you. So please check your chat there, and we will just confirm you're ready to ask your question live. Then we will unmute your phone line or your microphone line, and you can ask your question live. If you've joined us by telephone, you can dial *9, and we will be able to unmute your line that way. When you leave the presentation and the webinar, please complete the satisfaction survey by clicking on the link. We do appreciate your feedback. We use it for planning and improving our future webinars. After today's webinar, if you have further questions, please email those questions to cwis.questions@acf.hhs.gov.
Slide title, Introductions. Speaker names, titles, and locations are read by the moderator.
I'd like to now introduce our speakers for today's webinar. Our federal presenters will be Spencer Wilder, Federal Analyst with the Division of State Systems, and Tiffany Gardner, Federal Contract Support for DSS. Our state panelists will include Brian Washok of New York and Rebecca Coleman from New York. From Utah, we will have Jennifer Larson and Jonathan Hauser. Once again, I'm your moderator, Phil Breitenbuscher, and I'm also Federal Contract Support with the Division of State Systems.
Slide title, Agenda. 3 bullet points are read and described by the speaker.
It's now my pleasure to hand things over to Spencer. Spencer?
Thanks, Phil. So here's a look at our agenda for today. As always, we want to make sure that our guidance is always grounded in regulation. So we're going to start with a brief overview of the regulation and the details. From there, we'll transition into our 2 state presentations. We intentionally placed our state presenters second on the agenda to make sure that there was enough time for them to really share their experience and lessons learned and comments about the biennial review process. And then lastly, we want to provide some details around our guidance and some tips and possibly some upcoming TA about the biennial review process. So let's go ahead and get started. Next slide, please.
Slide title, Regulation Overview. A text box describing Regulation 45 CFR Section 1355-52 subsection D3 is split into 2 halves. The first reads, Automated functions meet the requirements of paragraphs B, D1 and D2. The second reads, Bidirectional data exchanges meet the requirements of paragraphs E and F.
So subsection D3 of 1355-52 is really the regulation that deals with the biannual reviews, and it just simply states that states are required to conduct the biannual data review process. For ease of understanding, it's probably best that you split this regulation into kind of two halves. That first half is really dedicated to your automated functions, and then the second half is really dedicated to your bidirectional data exchanges. Um, we recognize it's relatively short in comparison to the other CWIS regulations, but really want to draw your attention to the blue highlighted areas, referencing the paragraphs that your biannual review process should address. Once you expand these paragraphs, you get a much more detailed view of the areas that really should be the focus of your biannual review process. Next slide, please.
Slide title, Full Biennial Data Quality Review Requirements. The main header reads Focus Areas, and there are two columns below it with the subheaders, What to Address, and How to Address. What to address includes child welfare reports, Title IV-E eligibility, child welfare laws and practice, case management data, audits and reviews, Indian Child Welfare Act, National Child Abuse and Neglect Data System, and Child Welfare Contributing Agency. How to address includes timely, accurate, complete, alerts and notifications, no data reentry, and monitoring reports.
So, for example, if we're just looking at your automated functions, and these are paragraphs B, D1, and D2 of the regulation, you get an idea about all the areas that we are expecting your biannual review process to cover. You'll notice that a lot of these areas are pretty large functions and are pretty much comprised of smaller functions. So, for instance, if you're looking at case management, you know case management is very broad. And if you break that down, it could include assessments, it could include case plans, case notes, service level data. There are pretty big buckets. Um, but the intent here is that your biannual review process should address all of these issues. On the right side, you're going to notice the goal or the intent of what your biannual review process should really be looking for. So, in terms of um, the what you're looking for is that we're trying to make sure that your data is timely, accurate, and complete. Whether or not you have alerts and notifications to staff about being able to enter that data, making sure there's no data reentry. So making sure there aren't multiple places within your CWIS solution where that data is recorded and shared. And then what kind of reports are you generating on a regular basis to keep folks aware of those data quality issues and hopefully improving them? Next slide, please.
Slide title, Full Biennial Data Quality Review Requirements. The main header reads Data Exchanges, and there are two columns below it with the subheaders, What to Address, and How to Address. What to address includes Title IV-E and IV-B payments, CWCA systems, Title IV-E determinations, external child welfare systems, child abuse and neglect systems, child support, Medicaid, court and education. How to address includes single standard.
The second half, here again, if we're talking about your data exchanges, you know that there are mandatory data exchanges within all CWIS solutions. And so on the left side, you get an idea as to the fullness of all those data exchanges and what your biannual review process should be dedicated to at least covering. In terms on the right side and how to address it, we are asking that everything has a single data exchange standard, which is very important. These are kind of the rules and the formats for sharing data across systems, different systems. They include common formats around how the data is stored, shared, and their overall format, whether or not you're using CSV or JSON or your XML. But there should be only one data standard as you're working through your data exchanges. So the point of these slides is these two slides is not really to overwhelm the state, but it really is to present a full picture of what we're expecting to be covered through your biennial review process. We really encourage states to examine your practice, your policy, and your processes and determine those areas that are representational of your or representative representative of your full CWIS solution and really what should be monitored. The important thing to remember is that your biannual review should include a way to monitor every one of the standards in your DQ plan. Um, Here again, we're not asking you to do this out of the gate. And we know that many of you are relatively young in your kind of data quality and biannual review process. Um, and we also understand that we have encouraged you all to start small, start where you are with your DQ plans. And we're not asking for every data element to be examined and reviewed, but we are asking is that um, you really review your DQ plan because your biannual review process is only as robust as your DQ plan. The two are linked. So as your understanding of data quality issues matures, so should your biannual review process. You really should work to develop a repeatable process that starts to get at every part and every portion of your CWIS solution. Next slide, please.
Slide title, keep in mind. A large circle shaded light blue is labeled Automated Functions. It has a smaller circle shaded medium blue within it labeled Data Quality Plan, and that circle has a smaller circle shaded darker blue within it labeled Biennial Review.
Here we go. So before moving into the state presentations, wanted to give a real simple illustration of the relationships between these CWIS components. So each of these circles builds upon and supports and is reinforced by the other. So within your CWIS, you have a number of automated functions, and these functions capture just about everything, every aspect of your child welfare work to prevent and really to prevent child maltreatment and really provide services to vulnerable kids. Within each function, there should be a set of standards on how you all are measuring how reliable, valid, and accurate the data is within each one of these areas. Um, we'll touch on this a little bit more towards the latter part of the webinar, but the idea is that you should have data standards that really talk about how well you're making sure that the data within your system for each function can be trusted. And then lastly, which is really the focus of today's webinar, is the biannual review process is really the way that you monitor and examine and measure whether or not there are issues threatening your standards, your data quality standards, and how you're working towards resolving those. The overall goal here is really to reduce risk of inaccurate data. Without understanding the part that the biannual review process plays in this kind of an ecosystem, um, ultimately there's going to be little trust in your data and little trust in your overall CWIS solution. So just as a reminder, this covers the basics of the overall regulations. Um, and we just want to remind everyone that this is an opportunity to get information. And so here again, I know that Phil mentioned it early in the webinar, but the Q&A section is open. And so if you have any questions, please feel free to ask those questions. We will either answer them live or you'll receive a written response. But now is the time to ask. And so with that, next slide, please.
Slide text reads, State of New York.
So with that, I am happy to introduce our first state presenter from the state of New York, and I will allow them to introduce themselves and talk to you about their experience in actually conducting the biennial reviews.
Okay. Thank you, Spencer.
Slide title, New York State, NYS Office of Children and Family Services. The two speaker names and titles are listed on screen and the speakers introduce themselves.
And hi, everybody. My name is Brian Washak, and I'm with New York State Office of Children and Family Services, and I am the Director of Program Systems Support, as well as CWIS. So in my position, I am a liaison between our New York State ITS and the program side for any systems needs here in New York State, as well as the director of CCWIS. I'll pass it off to my colleague, Becky Coleman.
Good afternoon. I'm Becky Coleman. I'm the director of the Office of Research, Evaluation, and Performance Analytics, or REPA, as we say, since it's a bit of a mouthful at OCFS. And I'll get into this a bit more in a moment, but my office is really sort of central to a lot of the data discussions that happen at the agency. We are responsible for all of the federal reporting, state reporting, and oversight and management of our data warehouse. So we touch on data quality in just about all of the work that we do. I think if we want to move to the next slide, Brian, you're going to walk us through our structure.
Slide title, NYS CCWIS project status. Several bullet points for CCWIS status and state characteristics are read and described by the speaker.
Absolutely. Thanks, Becky. Okay, so our CCWIS status. So we are a CCWIS transitioning state with our connection system, which is our primary child welfare application here in New York, as well as our data warehouse, which is Becky's team. And our current CCWIS timeline brings us to 2027 at this time. And just some characteristics about our state. We are a county administered state, so it's a bit of a challenge for us. And as those who are county administered out there know, particularly being a larger county administered state, seeing that we have 59 counties, and then that is including one tribe, which is its own jurisdiction. And then we have New York City, which is also one jurisdiction and makes up about half of our child welfare population within New York State. In the calendar year 2023, we've had approximately 44,000 families receiving preventive services. We've had 149,569 registered child protective services reports and 14,834 children in care and custody as of December 31st, 2023. Next slide.
Slide title, NYS organizational structure, key players. 6 text boxes are shown on screen, listing the 6 different areas within the organizational structure. The headers of the text boxes read Bureau of Strategic Systems Innovation, Division of Child Welfare and Community Services, Information Technology Services, Office of Research, Evaluation and Performance Analytics, Council, and Bureau of Policy Analysis.
Okay, and I'm going to talk a little bit about our organizational structure here in New York, as well as the key players which do all the work here as far as CCWIS and data quality. So we have the Bureau of Strategic Systems Innovation, which I am part of, and the acronym is BSSI. So I said that Connections is our child welfare system here in New York, and we have an entire implementation team which works to support the child welfare contributing agencies out there, as far as the local districts, Department of Social Services, and the voluntary agencies that do the child welfare work. So manage a whole team of them. We also have a change board for any changes or potential changes to our connection system, which is a collection of OCFS staff, program staff, legal staff, and some local district staff and New York City staff, which we present potential changes to our CCWIS system to, and they get a chance to comment, and then we accept the changes or reject the changes based on the information that's shared in those meetings. Like I said previously, we're also liaisons with our Information Technology Services, our ITS team. So they are the main technology folks. We are kind of the go-between with systems. So we work directly with them on system changes, but they do have some programmatic knowledge as well. So here in New York, we do involve them on some meetings where we're talking about systems changes potentially because we do value their opinions and the programmatic knowledge that they have. And then also part of the BSSI where I stand is overseeing CCWIS and everything in relation to CCWIS. We also have the Division of Child Welfare and Community Services, and we have our Performance Quality Improvement Team, which works on the program side to work with the local districts as far as data quality initiatives and monitoring them, and operations and maintenance and oversight and monitoring and case reviews. So the oversight and monitoring, works directly with the local districts and does case reviews and, talks to them about how they're doing in different areas and areas of strength and areas, of improvement where they can do things maybe better a little bit differently. So we also have data leads, which is part of that organization where We have folks from all over OCFS who look at different areas of data and where we can have data quality improvement and the importance of data and how it could be used out there within OCFS and in the field. Then we also have regional offices out there. So New York State is broken up into different regions, from Buffalo, Rochester, Syracuse, Albany, New York City, Westchester. And we have different regions that work closely together and are part of when we have these discussions about data and working with the local districts. They are certainly part of those discussions. Moving on to ITS, which I did mention before, as I said, they collaborate with OCFS on all systems needs and do have, strong knowledge and contribute to our discussions on all things involving data and systems. And then we have connections, build, planning, and implementation. So we work with them closely as we roll out builds of changes and enhancements to connections and do UAT testing with them, and then work closely with our implementation team on doing that and getting ready for the build, and then them working directly with the field in order to roll out those builds to the field in the connection system. So I will pass it off to Becky to do the rest of the slide.
Thanks, Brian. So as I mentioned, I'm the director of the Office of Research, Evaluation, and Performance Analytics, and we are responsible for the federal reporting. So we submit all of the AFCARs, NCANs, NIDED, the New Family First files for New York State. And in that role, one of the key things that we do as new requirements come out, we check to make sure we're collecting what we need to collect to be able to do those submissions, and looking at what might need to be added to connections, or where we might need to improve some of our communications with the field so that they know what the data quality standards are, what the data elements are. We also have management and oversight of our data warehouse, which is the reporting arm of our CCWIS system. We allow access to that to a select group of agency and county and state level individuals have been given permission to see the data for their entire sort of regional areas. And within the data warehouse, they can access, we have over 500 predefined reports where they can take a closer look at their data, see what's missing, see what's inconsistent, monitor whether or not things have been done on time. We also, as being part of that sort of translation of the federal requirements, you'll see I have down on here the Unhappy Path group, which is really sort of a unique thing that arose out of our work with Families First and pulling together all of the different groups that are on this slide to start trying to plan what we needed, systems changes wise, training wise, data collection to make Families First happen. And I think you can probably all empathize with this. You think you know where you want to go. You have an idea of how you need to collect something, how it's going to work. We call that the happy path, right? Everybody's doing exactly what they're supposed to do. And then you start doing it and you find all these unhappy paths start coming up where things are just not going as expected, or something was misinterpreted, or the system change didn't work the way that you needed it to. So we noticed that we had a group that was coming together frequently because somebody was flagging an issue with implementation, with planning. And so we started nicknamed ourselves the Unhappy Path. And we started putting on regular meetings where people could just throw things up onto the agenda that they were seeing, where there were data quality issues. And that group and that core really became sort of central to how we are doing our biannual data quality plans, because we had this great cross-section of people in the room who were discussing data issues in real time, trying to problem solve them together in real time. And so we tried to take a very organic approach and build on that. And that's what I'll be talking about in the next two slides. I also want to make sure I do a shout out to our counsel's office. We obviously involve our lawyers when we are talking about what we need to do for data collection, so we are sure that we understand what the federal laws are, but also the state rules and regulations. We have a court attorney who works with the court improvement project. And so that's very helpful to get the court's perspective. And then we have our Bureau of Policy Analysis, which is really our main communication arm with all of our counties. And they issue our information letters, directives, and help to do our federal plan. So if we could have the next slide.
Slide title, NYS Data Quality Work Group. 2 bullet points with several sub-bullets under the second bullet point are read and described by the speaker.
So one of the things that we noticed, again, working on this Families First work in other places, was that we had a lot of conversations happening about data quality. And in my role, over our research office, I was sitting in or hearing those in many different rooms. So same conversations, but different rooms, and lots of times different players, or not quite the same overlap. And that we were sometimes duplicating efforts. Different groups were working on the same issue and not realizing somebody else was seeing it too. So talked with Brian, we realized we really needed to have a designated data quality lead. So my team agreed to take that on. And what we did was sort of take all of those members that we just mentioned on the other slide and people who are already participating in our Unhappy Path work group, pulled them all together and said, we need to sort of make this more formal. So we wanted that group to establish our list of data quality and concerns to help us identify and prioritize what we were going to work on. And to try and, like I said, integrate. So if somebody was mentioning a challenge that the field was having with being able to enter something, and we could see the challenge that was having on, say, one of our CFSR metrics, that we were bridging those conversations. And we wanted to use that group to then establish our work groups, figure out our priorities, and to be able to get all of the right expertise in the room, because often these problems are multifaceted, right? It's not just a system solution that's going to do it, or additional education or training. You need to hear all of the perspectives and sometimes approach it from multiple prongs. The other thing that happens, again, sure, not unique to New York, is that some of these things require a higher level decision or somebody who can make the final authorization. And it could be challenging to get on to the calendars or the scope for those folks. So we had this work group, we thought we could triage and only then move up the things that we really needed to. We can go to the next slide.
Slide title, NYS Data Quality Work Group. 3 bullet points with 3 sub-bullets under the third bullet point are read and described by the speaker.
So what we did was we invited all of those groups to come and sit down with us, and I took some of the different pain points and issues that we had been hearing, across the different months from the Unhappy Path, used that as a starting list, brought the group together and asked them if they could really help us flesh those out, if there was anything else they needed to add. So we ended up generating a list, I would say, of probably about 15 or 20 different pain points. Some were coming from Brian's Connections implementation leads, where they were out in the field with the counties, with the agencies, and they didn't understand something that was in the system, or they were looking at data warehouse reports that we had for them and they didn't think something looked accurate, or didn't give them everything that they needed. So they were emailing my team, or we were looking at our AFGAR's compliance and what we needed to make improvements there. So we listed them all out, and we sort of had a template where we asked groups to go through, identify what the problem was, what impact they thought it was having, what might be some of the potential solutions. We put those all out on a SharePoint. We asked everyone to go in and review them, to vote on what the top priorities would be. When we had those votes in, we brought everybody back together and we picked a top 4 to start working on, and then identified who were the key players from, again, policy, from legal, from the data systems, from ITS, from CCWIS, who thought they could contribute to that conversation or wanted to be a part of it, and set up those sub-work groups. So I'm in charge of one, Brian has one, we have another one on AFGARs that one of my staff is leading. Our PQI lead is working with the counties on timeliness and trying to understand the workforce issues there. Those work groups, subgroups meet on a regular basis, and then we're bringing the larger group back quarterly to talk about the targets that they've set, the goals and the timeframes, and how we're moving on those. So again, we really tried to take an organic approach, start with the things that people were already raising and bringing up, and then bring as many people into the room as we could to talk about them and try to identify our problems and solutions. And I think we can go to the next slide. And Brian's going to share some of our lessons learned.
Slide title, Lessons Learned. 4 bullet points are read and described by the speaker.
Okay, thanks, Becky. So as far as our lessons learned, to be inclusive and to have multiple voices and perspectives needed. So as I outlined a little bit and as Becky talked about, we're kind of complex in New York here with different folks as far as our office and the BSSI and ITS and program sides, regional offices, legal. So really don't hesitate to think of all the people who should be in the room here for these discussions, because you certainly don't want to get through having discussions and then realize you left out some key stakeholders. Clearly designate a lead, because you don't want, although you're going to have all these different voices in the room, you want to make sure that you think of the best person to lead the group, with any group you want, so that you have a designated person and a person with a good amount of knowledge to be able to, steer the group in the right direction. To look for a balance, strive for a mix of complex challenges and easy wins. So a lot of times, with this and looking at data and looking at data quality, there might be some things out there that we can look at and say, this would really help, and we think this would be relatively easy, because there's, surely there's a lot of complex things out there, but with easy things, a lot of times it's helpful to, get something under your belt, so to speak, and say, we did this and we made a difference. Even though it was easy, at least it was something we could check off our list, so to speak. And then make it real and connect it with day-to-day work and outcomes. So we talked really about, like, kids in care as an example, and we talked about the number of children we have in foster care here in New York, but reducing the number of children in care, and getting a better idea of how many children are in care are real world outcomes. We also have, and Becky mentioned different groups we have. We have a group around multiple person identifiers, which is a problem that we have here. And a lot of people in their systems, their child welfare systems probably have. If you have person IDs, you probably have a problem where you have multiple or duplicate person IDs. So in making that real, we look at child safety, right? If you have multiple person IDs for a child, or for a caretaker, you link that right back to child safety. So if you're trying to, get the field to be responsive on this, you try your best to link it back to things that are real and have to do with real world things. Okay, thank you. That's all we have here in New York.
All right. Well, my thanks to both you and Rebecca for giving us that overview. I want to stop just for a quick second and see if there are questions. I think we have a few questions
Yeah,
in the
thank you,
Q&A
Spencer.
to answer.
Yes, let's I think this one can go to Becky first. When you say my team, how big is the team?
So I guess I should point out there's a few different teams. If you're talking about the unhappy path group, we have about 15 standing members to that. Again, they come across all of those sort of 6 major groups that we outlined on the slide with our organizational structure. And those individuals are really our key or our link into their larger divisional or office areas. If we need them to bring in more folks, they act in that role. In terms of the Office of Research, if that's the question, we have a staff of about 30.
Wonderful. And let's see, we have just one more question, and I'll just throw it out to both of you and Brian. The question has come in: did you include a master data management or MDM capability in New York?
So I have to. Oh, go ahead, Brian.
Go ahead, Becky. Yep.
Well, I was going to say, I'm going to be honest that language is not language that I think we are using as much, but I was looking at the chat and the questions there in terms of, do we have a master record and client identifier? And the answer to that is certainly yes. That speaks to the one of the projects Brian was mentioning we were doing in terms of our multiple person IDs, where we're trying to make sure that we have a single client identifier, and that we can clearly match records to those. And that's one of the things that we do monitor. It's one of our primary data quality goals that we have currently, that we can look into the system and try to see how often we have individuals who look like they could potentially be the same person, and that we're putting that data in front of our counties for them to be able to make an evaluation as to whether or not those records should be merged or not, and recording their decisions.
Great, thank you. Brian, did you want to add to that?
Yeah, and I think that, you know, something that comes to mind is it's a bit of a struggle here, you know, in New York, because we have a couple of different systems, you know, main systems, primary systems that kind of interface with each other. We have our connection system, you know, which is our primary child welfare application. We also have like our welfare management system, which is an antiquated, you know, outdated legacy system from before even connections, which we think is old. Which we have a project underway to replace that system, but it's something that we look at as far as client identification numbers in that system, and then person identification numbers and connections, and those two things kind of interacting with each other, those two systems. So I think that, you know, something is being looked at as far as that project to kind of identify and have like a master person, so to speak, between those two systems when they do interface. But yeah, definitely, you know, continues to be a struggle, but it's a work in progress.
Slide text reads State of Utah.
Wonderful, thank you both. I do see that we have several more questions that have come in, but I do want to advance us to our Utah panelists before we continue on with questions. I do want to remind everyone you can continue to ask your questions. I see a hand up as well. Thank you very much. I will be chatting with you in just a second. Continue asking your questions via chat or by raising your hand. Use the Q&A function. Try not to post your questions in the chat feature if you don't mind. We will ask you to move those over to the Q&A. So continue to ask questions using Q&A, and we will have more time for questions following our Utah panelists. So at this point, I think we're ready to hand off to our Utah team.
Slide title, Utah Department of Health and Human Services Child and Family Services. 3 overview bullet points with the headers. Introduction, brief history of CCWIS project, and state characteristics have several sub-bullets that are read and described by the speaker.
Thanks, Phil. So just by way of introductions, my name is Jennifer Larson, and I'm the business manager for our CCWIS project. I come from the child welfare side and have been working in child welfare for the past 25 years. And then Jonathan Hauser, he's our technical manager, and he's also been with the agency for about 25 years. So just a little bit about Utah. We are state administered. We have 29 counties. And just in terms of point in time, we're a small state as compared to New York, just by way of even in the numbers. So just investigations that are underway, just a little over 2,000. Families that are in prevention services, just a little over 700. And then children in foster care, just about 1,800. Which is a low for us here in Utah. So that's something that we have been watching and seeing some of those trends happen here in Utah. But I'm going to let Jonathan take it over and talk a little bit about our history of our CCWIS project, and then we'll move forward.
Yeah, hi all. Yeah, before Jen talks to you about our data quality plan, I just want to give you guys a little bit of context on our system, who we are and where we're at with CCWIS. So backing up, so CCWIS, we participated in CCWIS from the beginning. Our stack was basic client server model, more specifically Power Builder, SQL Server, Sybase back in the day. And then a few years before the CCWIS regs came out, we did make an attempt at modernization by rebuilding some of the modules into a web app. We build and maintain our software in-house. The team is made up of child welfare staff, state employee IT staff, and contractors. The contractors work under a staff augmentation model, so they're like any other developer on our team. Work for them gets decided on in sprint planning, just like every other employee. So that's kind of the team and the legacy stack. So fast forward to CCWIS. a lot went into deciding one, if we were going to participate, if we were going to do it in-house or vendor, big banger, a module at a time, and what technology and architectural style we wanted to use. Those details are definitely topic for another webinar, but out of that, here's where we ended up with our stack. So on the client, so the portion that the users interact with, we're doing Angular framework with material component libraries. Our middle is .NET Core microservices for our APIs and gateways. The great thing about Core is we can run on Windows or Linux, although we're really wanting to get out of the server game, so we're going to be containerizing those. And then the databases are SQL Server, but we are going to move those to one of AWS's managed services, specifically Aurora Postgres. And that leads me to one thing I should mention. Partway through our CWIS journey, the state decided Jen and I didn't have enough stress in our lives, and we were told to migrate from on-prem to the cloud. And so that ended up being AWS for us. Ton of work, but it's definitely been worth it. And I mention that because we've added a bunch of AWS services to our CWIS stack. I'm not going to mention them all, but just to highlight a couple. S3, we rebuilt our content management system. So like the videos and audio recordings of child interviews, pictures, documents, all that stuff. Significantly more robust system and future-proof. Elasticache, we moved a lot of our searching to use an in-memory database. It's way faster for our users, and it gives us much better options for advanced queries. It's been really easy to iterate on, so we're just going to keep messing with that until our users have everything they need with searching. And then the last thing to mention that is tied directly to data quality is our data warehousing. It's hard for the agency to improve if the right people don't have access to the right kind of information. Without going into details, warehousing is all about table design that would be horrible for an application, but makes it a lot quicker to pull information you need. I ended up taking this on as a personal project and was able to build out what I think is a pretty solid platform for the agency. So for that, it's Aurora Postgres for the database. I'm using various AWS services for the extract, transform, and load, and then QuickSight is the business intelligence tool.
Slide title, Utah's organizational structure. The organizational structure is shown on screen. Some text boxes are outlined in blue for administrators, and some are outlined in orange for critical DQP teams. The top text box is blue and reads DCFS Director. Below it are two blue text boxes that both read Assistant Director. Under the left Assistant Director are two text boxes. The one on the left is blue and reads Professional Development. The one on the right is orange and reads Primary Prevention. Under Primary Prevention are four blue text boxes that read Intake, CPS, Prevention, and Domestic Violence. Under the right Assistant Director are four text boxes. The first two are orange and reads CWIS Director and CQI and Data Analytics. The third is blue and reads Federal Operations, and the fourth is orange and reads Ongoing Services. Under Ongoing Services are four blue text boxes that read Foster Care, CHAFI, Adoptions, and Kinship.
So that's kind of our stack. There's more that we're doing. We're even dipping our toes into AI with some unit tests and things, but again, that's a topic for another day. I'll just finish up with how CWIS is going for us. I think it's good. One of the ways to kind of test that is, I feel like the CWIS design system is supposed to help our teams keep up with changing technology. So how has that gone? As one example, kind of in the weed example, we originally started with Prime NG as our component library on our clients. It's a great product, but we ran into several issues and it was starting to hold us back. So we looked at Material, which is the library supported by Google, much bigger user base. We decided to give it a try with one of the modules. And the great thing is the impact was limited only to that module, affected nothing else. It was minimal testing. And when we got done, we just asked, do we like it? Do our users like it? Is it easy to maintain? And then we just applied it to the other parts of our CWIS application as we needed. And that same exact principle is applied to the .NET and Angular upgrades. That was something we could never keep up with framework updates under CCWIS, but we've done a really good job under CCWIS. And then a last thing to mention is the relationship with our federal team has been awesome. It's obvious that they want us to succeed, and they've been great at helping us work through roadblocks or concerns. So big shout out to Amit and Wendy, if you're listening. So thanks to those guys. So that's kind of our stack and how things are going. So I'll just turn it over to Jen to talk about our actual data quality.
Okay, we can go to the next slide. So I wanted to talk a little bit about our organizational structure here in Utah. We, as compared to other states, we're really small, and that has its advantages. So just here, just kind of organizationally, is kind of how we're laid out. So Jonathan and I'm the CCWIS director, and I work closely with those teams that are in orange. Our primary prevention, which oversees sort of our intake and CPS branch of child welfare, and then also our CQI and data analytics team. And I'll get to that in a little bit in the next slide. But I also work with our ongoing services, who really have program administrators that oversee our foster care population, our in-home population, those that are receiving Chafee funds, so our transition to adult living youth, our adoptions administrator, and those that are overseeing sort of our kinship functions. So one of the things that we have that's advantageous to us in Utah is all of us really at this particular level have worked with each other for a number of years and have well-established relationships with one another, which has been to our advantage in being able to have really great conversations about areas in which their specific program or their program area may need a little attention and help in terms of their data quality. So that has been an advantage for us. And go ahead to the next slide.
Slide title, Utah's review processes. 5 bullet points with several sub-bullets under the 4th bullet point are read and described by the speaker.
Utah has a well-established CQI process from 1994, and that was born out of a lawsuit that we have since exited a number of years ago. But what it did was establish for us a value of continuous quality improvement, and something that our agency really relies on and has for a number of years to be able to inform some of the things that we need to pay attention to. We also have department oversight for our agency that allows us to have some neutral parties being able to look at what is happening with our system, both in terms of our processes, some of those proxy measures, some of the data quality there, and then also what is happening outcome-wise. What is that all leading to, and how is that looking both in process and as the outcome? One of the things that Utah did have to sort of rebound from was our CQI and data analytics team was literally dismantled because of vacancies and moves and whatnot, and other issues that come with budget and personnel. But that team was almost went for a year without anyone in those positions. And so it sort of fell to Jonathan and I to be able to pick that up as part of our CCWIS development to look at the data quality and take on some of those responsibilities. So I've been with our technical team for about 4 years now, and one of the very first things that we did was look at what was going to be our CCWIS data quality review instrument, using the data management book of knowledge, and then incorporating all the things that are required in the CCWIS regulations. What do we look at that needs to be complete, timely, and accurate? What is exchanged, and how do we maintain that confidentiality? And going through some of the things that you see here on the screen. So we really did work with within our own unit to develop that. But then what we did was looked at some of the people that were in that organizational chart and look at how those program administrators really wanted to work within their program area to identify and assess the data that was specific for their area and come up with those SMART goals. So we really worked in tandem with them over about a year to be able to develop that. Next slide, please.
Slide title, Utah's CQI Team. 5 bullet points with the headers CWIS Director, CQI Team, Department of Health and Human Services, Program Administrators, and Federal Operations have several sub-bullets that are read and described by the speaker.
And so one of the things as we've gone ongoing in terms of our data quality plan and our biennial data reviews is we have pulled together this CQI team that you see here. So as the lead, I oversee all of the submissions of our federal reports. And one of the things that has really been helpful for me is some of the data quality indicators that we have through NCANs and AFCARs that look at some of the things that states might pay attention to or should be paying attention to as they're doing their submissions. But then we use that and we pull together our CQI team. We look at our CFSR state indicators that we get on an annual basis. We just had meetings before this meeting for those indicators to see really what do we need to look at and review as part of our biennial data review to maybe highlight some of those things, to make those things that we may be falling short in a priority for us in terms of our review and things that we want to do to be able to have good data quality. We also pull together our oversight process from the Health and Human Services, so our annual CFSRs that we participate in, and then our proxy measures, which is our case process review. Again, pulling in specific program administrators, and then also our federal operations team that looks at our child and family services plan. And my job really, in terms of the data quality plan and the biennial data review, is synthesizing all of this information into sort of one source and looking at what are the overarching themes that we're seeing across all of these indicators that would clue us in to say, these are things that we need to pay attention to, and we need to do some deep dives into our data quality and be able to see what is happening as it relates to our CWIS development, as it relates to our, what information is being entered into the system, where is that information coming from, what's the source of truth, those types of things. So those are things that we've been doing on an annual basis up until now. Go ahead and go to the next slide, please.
Slide title, Utah's Source of Information. The main bullet reads, Utah utilizes several sources to create our data quality plan. The sub-bullets are read and described by the speaker.
So again, several sources that we use to create our data quality plan. And, each state, I think, has its own sort of unique flavor of how they like to measure things. And ours, in particular, we have now are using results-based accountability, or RBA. So again, we want to make sure, at least as I'm developing our and looking at our biennial data review, is utilizing all of this information to decide and look at where is it and what sort of things should we be focusing on. And when there are hotspots or trends that we're seeing, what do we need to do to be able to remedy those issues, and being able to pull all of those sort of core teams together to decide what should happen and how do we want to further measure those things moving forward. So it's an ongoing process. One of the things that we noticed when we first started doing the biennial data review and the data quality plans is we had to overcome sort of this hurdle of knowledge that anyone even knew what the data quality plan is and the biennial review, and be able to get some buy-in specifically from program administrators to say, okay, these are issues that I have within my particular program area that I want to have some conversations about, to look at, and to be able to strategize around to be able to do that. So one of the things that we do now throughout the year to kind of give us a little bit of a jump start into our biennial data review. So if you want to go to the next slide.
Slide title, Utah Synthesizing and Communication. 4 bullet points with the headers each federal reporting period, CFSR state review, practice improvement coordinators, and Canary reports each have one sub-bullet that is read and described by the speaker.
we utilize things from each of our federal reporting periods. So our A and B submissions for prevention, for AFCARS adoption, NIDED, our NCANS data. We look at all of those on an ongoing basis now to better understand really what is happening with between a user entering information and the system being able to have the information it needs to make those reports. So looking at some of those disconnects that we have, and we've already identified some areas where we really do need to have maybe some re-engineering of some of our user interfaces to better enhance or to make the user experience a little bit better so that we can get better data for those for our federal reporting. We're also looking at the CFSR and our state review, including those annual reporting and looking at the trends. We also have in our state, we're divided into 5 regions geographically, and each of those regions has some practice improvement coordinators that work with our CQI and data analytics team, and looking at what are they looking at on a monthly, what's important to them that they maybe want to see enhanced or better utilized in terms of not just the data quality, but also how CCWIS is interacting and supporting the user experience with that. And then we also have some what we call canary reports. So these reports are things that we have that are sort of critical indicators for our system. And there are things like repeat maltreatment and abuse while in care and timeliness to permanency. Some of those things that really kind of let us know at a glance how our system is doing. So those are things that we have been using as we've gone along and kind of evolved in our biennial data review that have been really helpful for us in pulling this together in a way that kind of synthesizes everything and helps us make it feel that it's like just not another thing that we have to do, but is really integrated into all of the areas that we have to report our data to. And so that has been like the overarching goal for myself and our team, is to help this feel more integrated for our agency and be able to have them have some buy-in in what we are looking at, measuring, and reviewing. So that has been helpful just to kind of have that approach with our teams. Next slide, please.
Slide title, Utah's Lessons Learned. 4 bullet points read: start small, utilize what is already available, focus on the basics, and share knowledge across teams.
So just looking at some of the lessons learned from Utah is we would encourage states, if you haven't started yet, to start small. We started out really, really big, and it has been a little difficult to maintain because we started with like literally everything. And so I would advise against that, but starting what's really important to your state or things that you already know are trends for you that could be helpful in moving it forward, and utilizing what is already available. We really didn't have to reinvent any of the information. It was just about utilizing what was already there in a way that made maybe more holistic sense in terms of what Utah was trying to do with our data and how it supported our work. Focusing on the basics, that trifecta of child welfare, safety, permanency, and well-being, in terms of how that's measured or what is being used to be able to get that information across. And then sharing that knowledge across teams, because we know people aren't static and we have turnover. This has had to happen multiple times as new people have come on board or don't know what it is or why we're doing it. And being able to help them understand what the data quality plan and the biennial review is really supposed to do in terms of helping the state understand and pull together all of the different areas into sort of synthesizing it into one plan. So those are things that we would recommend that would maybe be helpful as states move forward with this process. So, questions?
Awesome. Thank you both. Yeah, so there's been lots of good questions, and we are doing our best to try to keep up with the questions that have been submitted to Q&A. And so feel free to continue submitting those questions. At this time, though, I'm going to move forward and hand things off to Tiffany.
Slide title, Approaching the Biennial Data Quality Review. A timeline graphic is shown on screen with 7 arrows in a horizontal line pointing right from each other. The arrows have text labels that read from left to right. Data quality plan is the foundation, collaborative cross-functional team, selection of priorities to achieve over 12 to 24 months, smart table, coordination of existing reviews and quality assurance efforts, submission of the review, and communication strategy. Each arrow has several bullet points underneath it that are read and described by the speaker.
Thank you, New York and Utah. We really appreciate you. We want to take time and talk through this diagram, provides a quick overview of approaching the biennial data quality reviews. As a reminder, your data quality plan is the foundation for this work and is a living document updated annually. This plan describes the review process and outlines how you're meeting the CCWIS requirements. It's important to remember that it's a collaborative effort and your agency needs input from program, policy, technical, and training to accomplish this work. And I think both of those states today highlighted that. Your agency selects goals or priorities that could be accomplished over the next 12 to 24 months. Are there findings from federal reviews or reports such as NIDID, CFSR, NCANS, or Title IV-E? What pain points from staff or your internal reviews have identified data quality concerns? Ensuring data from your child welfare contributing agencies and data exchanges are included to help inform the reviews. Potentially using a smart table to address the goals or priorities to make sure you include ownership and baseline data. An establishment of data governance to oversee and support those priorities and initiatives. Coordination of your existing continuous quality improvement or internal reviews to inform the review. This does not need to be an additional review process. When you're ready to submit the biennial review, you could provide a brief summary, touch on a couple updates of your data, your progress, challenges, and identifications of new goals or priorities. There's no template for the biennial data quality review, but our technical bulletin number 6 on data quality plans does provide a sample of the quality review instrument. And lastly, making sure that you're communicating those results both internally and externally to all of your partners. Next slide.
Slide title, Technical Assistance Opportunity. 3 bullet points with 3 sub-bullets under the first bullet point are read and described by the speaker. The email listed on screen reads cwis.questions@acf.hhs.gov.
We saw a chat earlier, a question in there, and we wanted to highlight a technical assistance opportunity for agencies. The goal is to create a work group or targeted TA to help identify best practices and toolkits to assist with biennial data quality reviews. Participating in this TA will assist agencies with a better understanding of their data, providing peer-to-peer learning, and create a model to help inform child welfare outcomes. The meetings will occur monthly for approximately an hour. There'll be internal working sessions within the agency between these meetings. We anticipate it will last between 6 months to a year. And if your agency would like to participate, please send an email to CCWIS email or please reach out to your federal analyst. We look forward to partnering with agencies to provide more tools and resources regarding biennial data quality reviews.
Slide text reads, questions and answers.
Awesome. Thank you so much, Tiffany. And we do have a couple minutes for questions. I'm going to see if we can get our panelists to respond to some of these questions real quickly here before we wrap up today's webinar. So I'm going to throw this to the New York team. Does your transition CCWIS have the ability to pull all the required data for biennial data quality reviews?
I think that's Becky. Could you take that question? I think our connection system, not so much. I think that's more data warehouse. So Becky, if you want to answer that.
Sure. Yes, for the most part, right? We are also setting up SMART goals for the items that we have picked for each of our biennial reviews, and we get that baseline data. So, for example, one of them is the timeliness for which our movement codes are entered. We have a 90% goal that everything will be entered within 30 days. And we can draw down data from our CWIS system that allows us to look at when did kids physically move versus when was the date that those movements were entered. And so we have then in the data warehouse reports that counties can go in and run on demand, and they can see across all of their different movement codes what was the length of time between when something occurred and when it was entered, how many are meeting that 30% goal or within 30 and 60 days or more than 90 days. We break that out for them across all the different codes. They can drill down to like where it's coming from within their county. So we do try to connect as much as possible our right CWIS data and the ability to look back at it to the goals that we've set. So that's just sort of one example of how we're doing that.
Awesome. I do want to point to our chat and bring attention to the survey that's now been placed in the chat for folks. If you'd like to take that survey now, that would be great. Let's see here. This question you may have just answered, Becky, but I'll go ahead and read it. Are there documented data quality standards that your teams adhere to ensure data quality in SACWIS or CWIS?
Yes. So each one of our goals that we're setting, right? We're putting on a time frame, we're putting an amount of improvement. Sometimes we're doing that incrementally. Again, our multiple person identifiers is, I think, Brian, a good example of that one, right? We had a larger percentage than we would like, larger volume, and we have been slowly raising the bar for that expectation over time as we're able to see how we're doing. So we're constantly looking at those metrics and providing that right feedback to our team, and then hopefully through that to the field so folks can see where we're going and where we're hoping to get to, and adjusting as necessary.
Okay. And I think if we could do, I think actually it looks like we've responded to all the questions at this point. There may be a few additional questions in the chat. We want to let you know that you can continue asking your questions at CWIS.
Slide title, Webinar Satisfaction Survey. Text describing the satisfaction survey and a QR code linking to the survey are shown on screen.
Or you can email your analyst or at our CWIS email address also. And we can drop that in the chat now too. I would like to ask for your participation in our survey as we wrap up today's presentation. That you can find the survey in the chat, and it will take less than 5 minutes. I promise you, less than 5 minutes to complete the survey, and we use that for improving our future webinars. All your responses are voluntary, and your responses are anonymous as well. I do want to thank our federal panelists, Tiffany and Spencer. Thank you so much for today's presentation. And of course, our panelists from the states of New York and Utah. Finally, I want to thank all of our participants today, and we appreciate the work you do on behalf of children and families. With that, we will conclude today's webinar.